Hey YouTube, my name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we are going to talk about dependent personality disorder, which is one of the three cluster C personality disorders which relate to some form of anxiety. Without further ado, let's get into it. As a frame of context, people with dependent personality disorder have a pervasive, excessive, and habitual need to be taken care of. These individuals are reported to be clingy, obedient, and they fear separation from their loved ones. And even small decisions they struggle to make for themselves. And what is the central feature? Difficulty with some level of separation. So in the DSM-5, there are 8 criteria that reflect dependent personality disorder. Now, you don't need all 8 criteria. You need 5 or more of the following symptoms. First, the person has to have difficulty making everyday decisions without excessive amounts of advice or reassurance. Second, they need others to assume responsibility for most aspects of their life. Third, they have difficulty expressing disagreement with others because of fear of loss of support or approval. Fourth, has difficulty starting or initiating projects or doing things on their own. Fifth, they go to extreme or excessive lengths to obtain nurturance or support from others, even doing things that they don't want to do or unpleasant. 6, they feel uncomfortable or helpless when alone because of fear that they can't take care of themselves. 7, they urgently seek a relationship as a source of care and support when close relationships end. And lastly, they're preoccupied with fears of being left to take care of themselves all alone. Now, as I said, you only need 5 of these, but with all personality disorders, we diagnose this after the age of 18. This has to be a pervasive symptomology, so 6 months or longer demonstrating 5 or more of these signs. Now, many people with this disorder report feeling distressed, lonely, sad. So there are some depression-like symptoms that are linked to dependent personality disorders. Some people report disliking themselves. These individuals can be at higher risk for depression, anxiety, eating disorders, and suicidal thoughts. And roughly 1 out of 50, or 2% of the population, experience this disorder, and there are no gender differences. So how do we explain the development of dependent personality disorders? Well, first, let's look at psychodynamic principles. If we were looking from a Freudian lens, the oral stage of development is when attachment and feeding practices are developed. So if there's unresolved conflict in the oral stage, there could be a lifelong need for nurturance. Object relations, so this is about how a parent-child links or relates to one another. So there could be parental loss or rejection that could interfere with normal attachment and separation. So there's these lingering fear or concerns with abandonment. And then other psychodynamic explanations suggest that the parents were either overly involved or overprotective, which creates a dependency on other people. From a behavioral point of view, this is about reinforcement and modeling. So parents might have unintentionally rewarded children for being clingy or loyal to them and punished acts of independence. Or the parents could have also had dependent behavior of their own, which they modeled and the child copied. From a cognitive point of view, there are 2 primary maladaptive attitudes. One is I am inadequate, and helpless to deal with the world. And two is I must find a person to provide some kind of protection. And these two faulty thinking or maladaptive attitudes keep the condition going, right? And it interferes with becoming autonomous or self-governed. All right, so let's talk about therapy. The primary focus is to help the client assume responsibility for their treatment, right? So the client or patient has to acknowledge that they have some responsibility in their choices, in their outcomes, and to do things on their own. We sometimes offer couples and family therapy because of the dependency. Sometimes it could be one partner is overly dependent on another, or one family member is putting a heavy burden on another family member. Both are recommended. So treatment for individuals with dependent personality disorder has some benefits, right? It's at least modestly helpful. So some help more than others. From a psychodynamic point of view, we're going to target a person's condition similar to the way we would target depression. From a cognitive behavioral point of view, there are two things. We want to challenge the faulty thinking, and then we want to encourage assertiveness. In terms of drug therapy, antidepressants can be helpful, especially if you see anxiety and depression co-occurring. And then group therapy can be quite useful because you have a group of people who are struggling with similar issues. Some are going to be more advanced or more developed than others, so they can show group members who are further behind how they're breaking free from dependent personality disorder. And that, my friends, is a very quick introduction to dependent personality disorder. Until next time, take care, everybody.